horse that's coming in today was a weight loss case, loss of condition and change in temperament as well, wasn't really herself. So today we're coming back in, she'll come into the stocks in the clinic, so we've got control of her and then sedated fairly heavily, but the procedure's done standing. We'll put a gag into her mouth because the scope is long and thin, and that means that sometimes it will come back on itself, and then the scope goes up the nose, into the esophagus or the gullet, down, seems like a long journey, but then eventually into the stomach. In this particular case today, there's been huge improvement both in the horse's temperament and condition, but also once we put the scope in, we could see that we actually had a good cure rate on the ulcers. We're about 95% healed at 4 weeks. Wensum Valley Vets has 5 full-time veterinary surgeons, about 70% horse work, 30% farm, still have dairies, beef units, do some pig work, plenty of sheep work. On the horse side, we would deal with a whole variety of issues from lameness problems, lots of dentistry, mares going to stud, artificial simulation of mares, and we would do a fair amount of our work in the clinic here on site, but we also travel out to people's stables and to yards and obviously to farms, so we are ambulatory and clinic based. We have 2 examination rooms for horses, one with stocks where we do our stud work, standing surgery, head x-rays, endoscopy, and again dentistry will be done in there, and then we have another room which is a same size room, a consultant room for horses, where we would do x-ray, ultrasound, lameness workups, nerve blocks, joint blocks, and on the side of that we have an equine operating theatre where we'll undertake a fair amount of surgery, not colic surgery but all sorts of other procedures. Routine dentistry in horses is a large part of what we do and something we are very proud of in terms of the quality that we offer. We advise that horses, ponies and donkeys teeth are done at least annually, but ideally a lot of horses we were doing and ponies we're doing every 6 months now. Beyond the routine floating of horses' teeth, we also do a lot of specialist work. We've got power tools, we do big reductions, dental removal, often involving head x-rays, and so it's a big part of equine practice these days and something we've taken fully on board, and we spend a lot of our time with teeth work.